have a more emerging experience, you're going to know more. You can definitely inform what you want your MPH to be a bit better, just because you know, like, sort of what kind of area you want to go into. So there's pluses and minuses to it. And one last thing too about the MPH that Maggie said I think is very important is identifying those skills that you want to sort of learn and trying to talk to people about what skills you want to develop. Because while it is, I think naturally it will inform the work we do, but I think at the end of the day, like, you need to have some sort of skill that you can, present and sort of be of use when you're working in healthcare.
Absolutely. Ron, we'll dovetail into your experiences with med school, if you wouldn't mind. Particularly, I know you mentioned before, it's been difficult for you to balance med school and really getting involved with global health. I think you mentioned that you've had some struggles with that. It would be really interesting to hear your reflections on this first year that you've had and how you've incorporated global health in med school.
Yeah, sure. So I think the biggest issue for me between, like balancing medical school and global health is really probably just balancing kind of like the big picture thinking that I've been used to in undergraduate and being on a national office at GlobeMed, and the really just hands-on, like, practical knowledge, basically micro thinking that you're inundated with in medical school. Because, I mean, we're trying to memorize every single muscle and nerve in your body. It's kind of hard to put things in perspective. But I think just at least reflecting on this past year, I think found that this so-called micro-thinking hasn't really made it harder for me to pursue the kind of big picture thinking that you need in global health, but I think it really has strengthened it. And I could talk about some things that I've been doing in medical school that have, I think, helped me gain that perspective. And so one thing that I've been doing right now, I'm starting to do right now, is I'm taking a class at the business school on management and innovation, and the class is pretty much geared towards global health organizations. So I think that should be really, really cool. And you get to meet many people who are in the business school. Because at Northwestern, there's an opportunity to take classes in other schools in addition to the medical school. But also, I think you just start finding that there are many opportunities in medical school to learn about global health and to really learn about yourself. And I've been involved in the community health centers here in Chicago. And I think the thing that I've kind of appreciated the most from working there, and also the thing that has helped me the most, is to really just learn about people and talk to people, which I think is something that, even as a medical student, you just are able to do more often than, say, just if you're not. And just like being in the medical profession, I think it's a privilege that people are willing to share their stories with you and look to you for help. And I can just give an example of just like a recent encounter I had with a patient. I went to the psychiatry clinic. It's basically a free clinic for underserved populations in West Chicago. And this one patient comes in. He's in his late 20s. He's a Polish immigrant, and he has a history of depression. And he comes in saying that he now has like just basically fits of rage and anxiety, and he just really, really needs help because he just had a son with his girlfriend of 11 years, and he really needs to set a good example for him. And like just anything that we could do would just make a huge difference in his life, because he recently gave up drugs and alcohol for his son and for his girlfriend. And at the end we ended up we prescribed him something, and it helped a lot, and we saw him again actually, and he got much better. And I think like these experiences really just helps you appreciate the individual moments you have with people, and you also you begin to realize that as a medical student you actually have the ability to change people's lives on a micro scale, which in some ways is extremely powerful. Also, in medical school, like you usually have, in terms of like how the curriculum is organized, you also have many opportunities to reach out to the community, and that has also helped a lot in terms of balancing the kind of hardcore knowledge and memorization that's involved in medical school to the more humanistic aspects of medicine. Right now I'm leading this project with an inner city high school, and we're setting up a mentorship program with high school students interested in healthcare, and kind of trying to cultivate them as leaders in their high school, and have them be positive role models for the younger students. And that has also really been a really rewarding experience. And also, just this past week for spring break, I went with a group to South Dakota, to an American Indian reservation to learn about the health disparities there. And we volunteered at the youth center and just helped out. And it's part of a long-term partnership that Northwestern has with that youth center. And we basically help them with their kids and also just learn about their healthcare system there and the hospital system there. And it's been really a powerful experience as well, just because it's 1,000 miles away from Chicago, but it's still in the U.S., yet in many ways it's kind of like a third world country going there. So I think at the end, again, it's balancing the detailed and the practical knowledge that you're inundated with in medical school with big picture thinking. I think it's not as hard as I had originally imagined, just because I think the personal interactions that you get to have in medical school and also just the skills that you have, the skills that you develop, just make that the process of big picture thinking much more powerful, because you're basically reminded every single day, like, why you're doing this. Like, with every single patient that you see, you're reminded, like, why you're in medicine and why you want to help people. And also, you also know that you actually possess a skill that you can actually use to help people as well. And also just another thing about how GlobeMed has fit into everything. Number one, GlobeMed has definitely been a key factor in developing my commitment to global health. It definitely opened my eyes to things that I never would have seen otherwise. And also just the importance of partnerships. I think that's actually a really powerful idea. Like in GlobeMed, we value partnerships and solidarity, and that idea is actually very, very, really, really important in other situations as well. I mean, I've used it in developing my project with the high school, and also we're in the process of strengthening our partnership with that Indian Reservation Youth Center as well. And these are all ideas that I've taken from GlobeMed. So you see that you can actually, the stuff that you learn from GlobeMed right now, you can actually use in a useful way in the future. I think at the end, medical schools definitely turned out to be much better than I had thought. I think there are just plenty of opportunities if you look for them, even once you go into your rotations when it's really, really, really busy. You still have opportunities to go out there. And I'm planning to do rotations in foreign countries, which is something that many medical schools allow you to do during your fourth year, because you basically have 5 months of free time after you finish your required rotations. And many med schools have partnerships with hospitals in other countries. So that's something that I'm planning to do.
That sounds really great. John, do you have anything to add what Ron was saying?
Oh, yeah. I just wanted to piggyback off when he said he's taking that extra course. And I did the exact same thing through the School of Public Health in the fall. And it was like a team-based course where we worked on a community health initiative at a local health center. And so it was just like a really a great experience outside of the classroom in a sense, because we were in the health center. It was like it was myself, another med student, and then 4 other public health students. And we were doing we were trying to increase enrollment in their outreach program for Black pregnant mothers, pregnant women. And so yeah, there's just countless opportunities there. And a lot of med schools, I mean, not all, but are shifting towards a pass-fail system. And so it gives you a little leeway to pursue these other outside endeavors. And then also just to, again, piggyback on Marissa with the sort of seeing patients informs, I think, the work you can do and, like, what work to do. And so that's just been sort of mind-blowing in a way of, like, revitalizing the passion, for this type of work. So.
Great. With that said, Christina, a very different but interesting perspective. How did you decide to go into domestic health policy, and what has been your motivation, and what has impassioned you to pursue this, and what have you learned, and just how has your path evolved?
Mm-hmm. Well, I was always especially interested in the healthcare system in the United States.